What does real-world success in business actually look like? Welcome to Bearcats Mean Business, the official podcast of the University of Cincinnati's Carl H. Lindner College of Business, where inspiring career stories, honest lessons, and fresh business perspectives from the people building impact in the real world come together. Tune in for inspiration, practical business insights, and forward-looking thought leadership on how ambition turns into action. And now, for today's episode.
Debbie, it's wonderful to have you here. Thank you so much.
Well, Dean, thank you very much for having me here.
I find your career journey just remarkable and inspiring. You're currently the president and CEO of the Christ Hospital, and you've risen from a student nurse aide to senior executive. And I've read so much about you, and it's more fun to talk to you in person. Yours strikes me as a career marked by persistence, adaptability, self-directed learning. I think I'd love to start with, was your dream always to become CEO? Is this what you expected, to be sitting here now?
Well, no, not at all. And if you would have asked me 38 years ago, would I ever be the CEO of the Christ Hospital Health Network, my answer would have been no. Because I loved being a nurse, and I never really thought I would do anything other than be a nurse. But then over the course of my time at the Christ Hospital and at the Health Network, I was offered opportunities to do different things. And, I'm a non-traditional sort of career person because I had a bachelor's and a master's degree from the University of Cincinnati before I ever went back to nursing school. And the reason that I fell in love with healthcare probably goes back to my childhood when I had a crush on a physician in a television show called Medical Center.
Okay.
And loved the whole healthcare environment back then. But I worked as a nurse's aide in a local nursing home to pay for my college. And so I grew to love taking care of people, and I grew to love the whole healthcare profession there. And so after I got a master's degree, I thought, well, gosh, what am I going to do with that? And decided to go back into healthcare to really pursue my passion, and fell in love with it, and then had an opportunity to go into management. Mm-hmm. And at the time, I had just delivered my son and thought to myself, well, I don't know if I can do this, and I don't know if I'll like it, but I love doing what I'm doing, so I will try. And if I don't like it, I will go back and return to the ICU, which was my first love, the intensive care unit.
Right.
And I ended up loving that experience because I got to see the impact that you could make on more than just the patient you were taking care of. And I watched a team flourish in some really difficult times, and we became very, very successful. And so that's really how my entire management career started.
I think it's fascinating, Debbie, I'm hearing the way you're talking about it. Your career has been one of breadth as well as depth in the health system. I mean, from IT to operations to, and you and I have spoken about this once before, but when I asked how you expanded to get so much, you built such credibility in your leadership by having seen all the different elements. You told me something about you going it when you first went into IT that you knew enough to be dangerous. Why'd you take the job, and then how did you learn through it? Those are big changes.
Right. Well, and I think as a leader, what I've learned is that a job description is one thing, and what the job actually is quite another. And so even when I became the chief nursing officer, right, I had a lot to learn. I was a director and then moved into an executive position, and I did that for about 13 years. And I learned something every single day, which is part of the beauty of being able to have different experiences. And when I took over as the chief information officer, it was in a very interesting time in the health system, and there was a need. And I thought to myself, well, I know enough because I've worked with some of our IT functions, but it seemed very exciting to me. And as I was looking forward, I knew that it was going to be something that would be influencing the health system for years to come. And so for me, it was another way to learn about the organization. And, I learned things about our organization during that time that I probably would never have learned if I would have just stayed in my lane. And so I think that's part of leadership is we have to always be willing to learn something new, to stretch our thinking so that we can help lead those who are trying to achieve the strategic plans of our respective organizations.
It truly might be our ultimate skill is the ability to learn. And I love hearing that from leaders. I try to share that with students. I look at your even your CV and see, you've been to all the major higher education institutions of the region. You are a lifelong learner in a very intentional way. It's more than degrees, though. Would you share a little bit more about how you learn and help others learn with you?
Right. Well, I think, my father used to always say, "Are you ever going to graduate?" And I used to say to him, "No, I'm not going to, because it's part of my responsibility as a leader to try and be the best person that I can be to help lead others in the way that they needed to be led." And sometimes I think it's formal education. Sometimes I think it is education through reading on your own, through professional seminars, through affinity groups where you can hear the different breadth and depth and perceptions of others who may have your same circumstance or, quite frankly, may have a very different perception of the circumstance that you may be dealing with. And so I have a leadership philosophy that not only do you hope that your organization that you work for will help you grow, but I also believe that we each have a professional responsibility to grow our own.
Well, I could not agree more. It leads me to a question also about leadership. A former president here at UC was named Warren Bennis. Some consider him the founder of the field of leadership. And he had a saying that became really a mantra that we often use here, that leadership is forged in the crucible. That in our toughest times, we find our greatest strengths, and we kind of dig deep. I know you've had plenty of those kinds of crucible moments. One that strikes me as particularly important was the COVID-19 pandemic. There was no playbook. This was completely unprecedented, and an incredible time for learning about yourself, the organization, your team. I wonder if you could share a bit about how you approached something of that magnitude.
Sure. As you said, it was a frightening moment for all of us in healthcare because we are traditionally driven by science, and we are traditionally driven by trial and error that becomes the scientific evidence of how you provide health care. Well, all of that playbook was gone because there was no science, and people didn't really understand what the trajectory of this was going to be. And so you really have to dig down deep, right, into your own personal acumen, but then you have to rely on your teams, and you hope that you have built teams around you that can be vigorous in their efforts and can be creative, because we were creating as we went. There were often times when we would meet in the morning, chart a path for the day, and literally hours later we're changing that path because there were external forces that we did not anticipate would be a part of what was going to challenge us either for that day or for that week or, quite frankly, for months to come. And so your teams were having to huddle and try to think creatively about how they might provide that same quality of care, but in a very different way, and break norms and rules that we had ingrained in them for years. And we are now asking them to put that aside, but to still try and make sure that those patients were getting the finest care that they could possibly get under some extremely difficult circumstances.
I imagine that the culture that you have developed played an enormous role, even though there were so many unforeseen elements to that. I was talking with a colleague of yours, Steve Rossfeld, and I was asking him a bit about the culture, and I've read about it as well. I mean, you are known so much through the Christ Hospital Network for this deep culture of care and commitment. Building culture, though, is really challenging, and sustaining it probably even more so. How do you think about that from a culture building side of leadership?
Well, you know, the old adage, culture eats strategy, is so true. And I think it helps that I grew up in the health system. I've literally done just about every job that you could think of
like it.
in the health system. And I have a great respect for each one of our team members. One of the things that's really important to me is the concept of team. And so we do not call our employees employees. They are called team members. And I use a lot of analogies of team sports, and I think about the Super Bowl that just happened last night, right? And two teams that should have never gotten to where they were, and yet one of them comes out victorious. But the other one has a lot and did learn a lot through that entire experience. But every team member within our health network has a key role in delivering on the promise that we've made to the community, whether it's helping to ensure that we have excellent clinical outcomes or an excellent guest experience, or doing so in an affordable way so that everybody in this community can get world-class health care right here in Greater Cincinnati. And we try to instill that in the team members through reward and recognition, through helping them to grow to be the best that they can be, through ensuring that they are celebrated when they do wonderful things, and even when they're celebrated for doing things that might just seem like that's just part of my job.
It brings me back to your mantra and your emphasis on learning as well, because you also like to look for benchmarks, and often outside of healthcare.
Yes.
I wonder if you could share a bit about how you find those benchmarks and give us an example, because I know you have some good ones.
Right. Well, it's important to me to understand, if you think about our strategic plan, how do I deliver exactly what I've promised? So if you think about experience, patient and guest experience is different in different industries, but it's yet still the same. So we have brought the Ritz-Carlton in. We have studied Disney. We have studied the airlines. Now, some might say good or bad experience, but it's really about taking the best principles from many service industries and trying to say, how does that translate into the healthcare situation? Because people want to be treated as human beings. They want to feel like people care about what their circumstances, whatever that might be. And they want to know that people are going to go to the nth degree to help them have a great experience, regardless of what service it is that they are asking to experience.
Yeah, absolutely. And living up to your promise in that way is, it clearly it is embedded in the culture, and that's why it eats strategy for breakfast, right? Because then it's everywhere without having to call upon it. You just count on it.
Right. And, you know, for us, taking care of people's health, which is their most important asset, is a privilege, but it's a huge responsibility. And, you know, in order for us to be able to deliver on that promise, we benchmark ourselves against all. Some people say, well, let's just benchmark ourselves against something of our size. And I'm like, no, people do not care how big or how small we are. All they are interested in is their experience. So we need to make sure that we're the best of the best, regardless of our size, our shape, our complexity, because that's what people in Greater Cincinnati deserve.
They do. And I think in the point of Greater Cincinnati, you care very much about this city, this region. I see it in your civic leadership. It's something we talk a lot about with our students, is that great leaders think beyond their own organization, because your stakeholders are so much farther reaching. And I have the great privilege of serving on the United Way board with you and seeing your leadership there. I'd love to know more about why, your why, and because you're very busy. You've got work, family, a life in so many different ways, and you give back to this city in some very big ways, and it clearly matters to you.
Well, thank you for recognizing that. I think it goes back to my upbringing. My grandparents really had not very much money, and they were certainly of no means farmers, came from a small town in Indiana, and they literally would have given the shirt off their back to anyone. And that translated into my parents, who had an incredible work ethic. My father didn't even speak English when they moved to Cincinnati. He spoke German. My mom was a high school graduate. And they taught me early on that it was really important to take care of others around you. And I'm very faithful. I'm Catholic by upbringing, and that was part of our faith. And, you know, we had one car when I was growing up, and, you know, a treat was to have a soda and go to Ponderosa on a Sunday evening. My mom worked until she was 70, and this is the work ethic that she had. When she passed away very suddenly, she had worked at McDonald's her entire work life after my second brother was born. And they closed the McDonald's for the entire 3 days over the course of her funeral so that all the employees at McDonald's could go and pay their respects. And that's the kind of household that I was brought up in, is that it's our responsibility to give back to others. And so as I have ascended into different roles, I feel like it is a professional and a personal responsibility to give back to others that probably gave back to me and I didn't even know it. And so being on boards like United Way and Arts Wave and a number of other boards that I've been on is really important to me, because it's the vibrancy of the community that we serve that will not only impact their health, but also it will impact how well Cincinnati does as a whole.
It is. It's so interwoven. And we have a great city. I mean, of people who do care, especially at the leadership level. It's something that matters a great deal to me, and I want our students to understand that's how great cities thrive.
Well, when you look at per capita in Cincinnati, the philanthropic support that is given to this community to help those who have need is by far and away much greater than in many other cities of our size or even bigger. And it's because of the great legacy of families that live here. And it's all about how do we elevate this city to make it a great place for people to bring their businesses, to bring students here to study, and then to keep students here once they finish their degrees. I mean, our health system was started through the philanthropic efforts of James Gamble, the founder of Procter & Gamble, who looked out into the city back in the 1880s and said, I'm going to build my soap business here and my candle making business with William Procter, and what do we have to do in order to make this a great place for people to work, people to live, people to play, to raise their families, and here we are 137 years later.
Isn't that a testament? I love that.
Yes.
That's wonderful.
Yes.
Thank you. At the Lindner College of Business, we strive to empower business problem solvers. That's our mission. And we believe if we can help students, wherever they end up in a career or a location for that matter, that if they can be great problem solvers, they will have meaningful, impactful lives as well as be successful. And when you think about your own problem solving, particularly when it comes to unforeseen challenges, I wonder if there's an example. I think we know the legislative challenges. There have been so many dynamic changes. How do you approach a problem? Can you give us a little sense of that?
Well, first of all, I think you have to understand your business, and then you have to really dig into whatever that challenge is going to be and how you might think it's going to affect different aspects of your business. So let's look at some of the legislative challenges just in healthcare. So up through, we'll say, July of 2025, no one really anticipated what you can call it the big beautiful bill or HR1 was going to, and how it might impact the healthcare system. So now that we know what it is, we are diving deep into what do each of those elements mean, and then really taking a hard look at our industry saying, okay, if this is what the bill means, then how are we going to react to that? And this is where I think ingenuity and creativity has to come into play, and using industry leaders to try and help formulate plans for that, but then also thinking about how are we going to transform the way that we are delivering care that will do so in an even more efficient manner, but yet keep the same outcomes or even better outcomes.
I so appreciate the way you explain that, Debbie, because I hear your systems thinking. You think about how all of the parts work together. I mean, I think that part of that is your breadth, but I also think you're thinking beyond healthcare, because it could be everything from insurance, right, to the financial sector. How do we make this work so that we don't have unintended consequences that take us the wrong way?
And then really thinking about what are the innovations happening in either our industry or in others when we think about agentic AI. And that won't be the answer for everything, but how can we use that to either improve the healthcare experience or really to make people more effective in the jobs that they have? Because one of the things that I think about is the demographics of the United States, and with the birth rates the way they are, the workforce of the future, in terms of just sheer numbers, are not going to be what they are currently today. And with 10,000 Americans going onto the Medicare payrolls, that means 65 and over every day. 10,000 people move into that category. The number of people coming behind them is not as great. And so that workforce of the post-World War II era, those numbers aren't going to be there. So how can technology help us to deliver the same products with maybe less people? It's not about taking people's jobs away. It's about how do we make people more effective in a place where there may not be that many people to deliver those same services.
I appreciate the way you even described that, Debbie, because I hear you playing a long game and thinking about today, right? Managing that tension of today and tomorrow. Right. With the rate of change, whether it's AI, legislation, I mean, there's so many changes going on, and the rate, we're never going to slow down. I mean, people have said that before, but I wonder what you think that means for leadership. Do you envision leadership or the needs of leadership changing in the future?
I think that leaders are going to have to be extremely creative. I think leaders are going to have to be incredibly inspiring. And I think that leaders are going to have to be, again, and I say this to our new team members, you are going to constantly have to challenge yourself to learn about what is coming so that you can apply it to what is happening today in order to influence the trajectory of your respective organization.
Oh, absolutely. You know, we're very proud of our Bearcat alumni, especially someone so inspiring as you, Debbie. If you're sitting in my seat, what would you be telling to students today? If you could give them some advice looking back, what would you like to share?
Well, the first thing I would say is find your passion. And that passion, quite honestly, may change over time, but find something that you love to do, because we spend a lot of time at work, we spend a lot of energy at work, and we spend a lot of our human capital at work. So I'd say find your passion first. The second thing I would say is be determined, because oftentimes your path might not be a straight line. My path was not a straight line. And sometimes there are disappointments in that, but stay determined and stay on the path. Because if that's your passion, it can happen, but it may not be in the manner in which you think. The third I would say is to be a lifelong learner. Mm-hmm. And the last I would say, and I say this to every young person that I mentor, put your hand up and volunteer. When the call goes out about, I need someone to do this, even if you're not sure if you can do it, put your hand up and try, because you will learn something every single time you do it. And it will open doors that may never, ever have been opened if you didn't do that.
You just never know.
You just never know.
But putting up your hand, taking the initiative, continuing to learn, so many insights. Thank you for your thought leadership as well as your active leadership in this community, certainly at the Christ Hospital Network. Thank you for all you do, Debbie, and for being here today.
Well, thank you, Dean, and it's been an honor and a pleasure to be here. This is a wonderful organization, and I'm so happy to be able to help the students.
Thank you for listening to this episode of Bearcats Mean Business. If today's episode sparked a new idea, challenged your thinking, or helped you see your path a little more clearly, be sure to subscribe, leave a review, and share the episode with someone in your network. Thanks for being part of the conversation. And remember, real-world success begins here at Lindner.